Hi, I'm Corey and I'm a physical therapist and I work with athletes of all different stages recovering from injury. And today we're going to talk about specifically recovering from knee injury and what you can do at home to ultimately get you back to sport. There's 3 different phases. So the first is the neuromuscular activation phase, followed by the strength building phase, and then lastly the return to sport phase. So again, we're going to go ahead and demo these things at home and we'll go ahead and get started. So whether you're recovering from an ACL tear, a meniscus injury, a surgery, or even just general wear and tear, ultimately this is where recovery starts, and that's in the neuromuscular activation phase, or what we might also say the precaution phase. So here we're really focused on getting this quad to activate as well as getting some gentle mobility through the knee. So the first exercise is going to be a quad set, where essentially you're just squeezing that quad. So I'll go ahead and have Wes go ahead and try to squeeze your quad. And you can see he gets a nice contraction there. After an injury, it might actually be hard to do that, so it might not look quite as easy. Some ways that I can help him with that is by using a towel to cue him to get that leg straight. So I'll go ahead and start with it under the knee here, and I'll ask Wes to push down into the towel. Perfect. I can also put it underneath his heel. Yep, and I'm gonna have you go ahead and straighten and try to squeeze that quad. Perfect. So those are called quad sets. Again, you can do them with or without the towel. More is often better. So as much as you can, go ahead and try to squeeze that quad. The next exercise we're gonna do are called heel slides, and we're gonna work on getting that knee flexion or bend in the knee. So I'll have you go ahead and you're gonna slide back and forth here. Yep. Go ahead and bring the heel towards your glute and then back out. And ultimately you'll go just as far as you feel like you're able to. As with any exercise, you need to make sure to check in with your physician if you do have questions or you're not sure where you're at. But again, most rehab will start here because it tends to be a lot more gentle on the knee joint. And ultimately, once we're done with this phase, we'll then be able to move into the strength and the hypertrophy phase, where we're really focusing on getting your lower body muscles strong, specifically targeting the quad. So the first exercise that we're gonna show is the terminal knee extension exercise. So you're gonna take a band that's in a loop and put it around some sturdy furniture like so. And then I'm gonna go ahead and have Wes step in to the band here. It's gonna go directly behind his knee, so right about there. And then what I'm gonna have him do is go ahead and squeeze your quad, pushing the heel down into the ground. Yep. And you actually want to make sure that your toes are lined up here so that you're not cheating and using more of your left versus your right if we're focusing on the right leg there. And so by doing that, he's working not only that quad strength, but again, reinforcing all of that extension we've also been working on here. So making it harder, you can do longer holds. I'll typically have people do it for like 1 to 2 minutes so that they're just getting a lot of reps in, but really again, laying the foundation for really getting that quad strong. And this will take us to our next exercises, so the wall set, where we really focus on building even more strength. And this is a really good one, early days of strengthening, right? So we're really just trying to get that quad to fire. So I'm gonna go ahead and have Wes put his back against the wall, and you're gonna step out your feet ever so slightly there. You wanna make sure again that those toes are nice and lined up. And then you're gonna try to go towards 90 degrees. If you're not able to do 90 degrees to start, that's totally fine. We can just back it up. So we can be at about 60 degrees, something like that. But if he's able to, I'm gonna have him go all the way down to 90 degrees here, making sure that his back and his head are against the wall. And we're just gonna hold. So we'll do holds for about 30 seconds. If that feels okay, we can go all the way to a minute. Great job. And so really, you should really feel those quads working. Something to keep in mind too is just making sure that you're putting equal weight through your right and your left leg. So oftentimes folks will, preferentially load their leg that's a bit stronger, but making sure that we're loading right and left equally. Okay, so the next exercise that we have is the sit to stand, and ultimately that becomes a squat. So again, we're early days of loading. It's gonna be really hard to just get in and start doing a bunch of squats, especially with weight. So the sit to stand is a great place to start. And so here he's using his arms for support. If that's what you need to start, that's totally appropriate, totally fine. But if he's able to, I'm gonna have him go ahead and cross his arms over his chest here. Yep, and then go ahead and do the same thing. So you're standing up, good, and you're sitting back down. Again, things to focus on, especially after recovering from knee injury, is that he's driving through those heels and really squeezing the quad at the end to make sure that he's getting that full terminal knee extension. And as this starts to get easy, he can start to make it more difficult by then transitioning into a squat, where at the bottom, he's not going to sit down, but rather barely tap his butt to the chair there and then coming back up. It's a really foundational exercise to start building strength. So far, we've covered the first 2 phases, the first being that neuromuscular activation phase, And then we went straight into the strength and hypertrophy building phase. Now at this stage of your recovery, we're really thinking about what you need to do to return to play. And at this point, we're starting to introduce more heavy loading, and MonkeyFeet is a great tool to use to help us get there. So he's gonna go ahead and attach MonkeyFeet to the dumbbell. I always recommend starting with low weight. So really you should be doing every movement with body weight first to make sure that you tolerate the load. And then from there, we can start with even just 5 pounds should be enough. And then if that's easy, we can always progress with additional weight, reps, sets, etc. So Wesley's gonna go ahead, he's gonna put his knee on the bench here, and he's gonna lean forward slightly. So the biggest thing is that we want him to flex the knee and not the hip. So sometimes folks will compensate that way. And all he's gonna do is gonna bring that heel up to his glute. Yep, nice and slow and controlled, just like that. Count of 3 going up, and then 1 to 2 seconds going down. That's perfect. All right, and so we're just gonna go and transition into our next exercise here, which is gonna be loaded hip flexion. Stand up nice and tall, making sure to actually squeeze the left glute, and he's just gonna bring that knee up and then back down. Again, we start with lower weight, and we can always increase weight as you're able, or increase things like reps and sets. And I've worked with a bunch of different individuals in clinic, and we use MonkeyFeet at this phase, doing a bunch of different exercises like so, ultimately to get people back to things like hiking, jogging, soccer, whatever the sport really, you do need to establish that lower body strength, and MonkeyFeet can be a great way to get there. So we're focusing on getting that hip flexion, really targeting the hip flexors on the right. But in addition to that right leg, we're actually working that left leg stability as well. So you can see him wobble just a little bit, and that's because we are targeting the left leg muscles too. So now we're gonna go into our last exercise, which is gonna be seated knee extension. And this is the holy grail of exercises, especially for recovering from something like a knee surgery. In order to just get him in the best position here, I'm gonna go ahead and place this towel roll just right underneath the knee, and that allows his foot just to come up ever so slightly. So with this exercise, I'm gonna have him go ahead and just straighten the leg, pause at the top for about 1 second, and then slowly lower the weight down. Again, we start with lower weight, we can always advance that. This is such a good exercise because it really isolates the quad. So things like squats are great, right, for building quad strength, but you're utilizing other muscle groups. In this specific exercise, we really are focusing solely on that quad. I love using this in clinic because it's really hard to find different ways to load with knee extension outside of a typical knee extension machine, which is just so costly and not available to most people. You can also easily use this at home. So it's a great tool that I've had patients actually take on themselves, where they can start to do loaded knee extensions. In addition to that, this is a great way to assess quad strength, because as I mentioned, we're really isolating the quad in this position. And so what we can do is we can actually see with a given weight, how many repetitions can he do on each side. One of the goals when we talk about recovery, especially after ACL surgery or other knee surgeries, is how strong is your leg relative to the other side? And we're really shooting for 90% symmetry here. So what we can have him do, as I mentioned, is use a certain weight, trying to approximate something like a 10 rep max. A really easy way to do it is just to take a heavier weight, see how many reps you can do on one, see how many reps you can do on the other. And again, you want about 90% symmetry. Ideally, you're hitting, 100%, that would be fantastic, but it does take some time. This is a really quick way to just estimate what your strength will be without needing fancy equipment. Very easily accessible and something one can do at home. And not only that, you can do repeated measures over time. So it's always good to just check and make sure where you're at every stage of your recovery. So, what does it look like 6 months out, but what does it look like a year out, 2 years out, etc. You can keep going. As with any exercise program, be sure to consult a physician or a physical therapist before you start anything new. That definitely applies here, as this is not medical advice. And ultimately, as you're recovering from knee surgery, it's all about consistency, doing the right thing at the right time. We hope that this has been informative for you, and that whether you're an athlete or you're just trying to live every day pain-free, that this program can provide a little bit of a roadmap as you get started with your rehab.